Hi, I'm Dr. Stephen Dayan, and it's my pleasure to speak to you today about something I'm very passionate about, and it's rhinoplasty, a procedure which I do over 150 times a year, and a procedure that I've been trained for doing for many years. Rhinoplasty is one of the most satisfying procedures that one can undergo. The nose as a leading feature in the face really is a defining characteristic of the face, and the goal with rhinoplasty is to make you look natural, one in which no one knows you had something done. Following rhinoplasty, many of my patients tell me that other people don't know what they had. They look at them and they say, boy, you look better, or you look rested, or like you've been on vacation, but they're not really sure what you had done. That's what we do with rhinoplasty. We fit the nose within the balance of your face, and no one knows that it was done. When we evaluate the nose, it's a very detailed process. We look very closely at the nose, and it's not just an aesthetic evaluation, it's also a physical evaluation. How well does your nose function? But physically, looking at the nose from the outside, well, we have many standards that are set forth, and we learn about them during our training. We look at the face and we evaluate the vertical fifths and the horizontal thirds. And what I mean by that is we break up the face into symmetric fifths, and we look to see if your nose fits within the central fifth of your face. And we also break the face up into horizontal thirds, and we look to see if your nose fits within the horizontal middle portion of your face. My background as an artist, I spent years doing terracotta clay sculpturing, has taught me the ability to look at the face and understand different light shadows and reflexes to better understand what looks best for you. We look for specific lines we call the tip defining point. We actually draw a line from the eyebrow down to the tip defining point. We want that to be a straight line. We look at the angle of your nose. At what degree is the tip of your nose turned up? 95 to 105 degrees. A lot depends on how tall you are and how short you are. Females versus males, it may differ in the position of the nose. Think of Nefertiti's nose versus Michelangelo's David's nose. And we're able to determine from those what the ideal position of the nose is. So when we evaluate your nose, we also look at your breathing function. Being a board-certified otolaryngologist, I'm able to understand better about the inside of the nose. I'm able to understand what it takes to make sure that you breathe well in addition to looking good. So one of the things we can do is we can take your photograph, and we can help to determine what you're going to look like afterwards. And it's best used as a communication device, one in which I can tell you what's possible and you can tell me what's important to you. So here's a photograph. This is before, and here we can alter it to show the after. So I can work with you to determine if you want more rotation of your nose. Do you want your nose up a little bit or down a little bit? So here we'll bring it up a little bit. And then I can bring in the hump a little bit. Here's a large dorsal convexity. So I can bring it in just a bit and see if this is something that you like. Now ideally we're looking for a nose, especially in a female, that has a little bit of a concavity to it. Not too much, but just a little hint of one. And then how about this angle? Is that something that you desire? And I can bring this angle in a little bit too. It's called the nasolabial angle. And I can show you this and tell you, do you like that better? Or I can take your chin out a little bit. How about bringing a chin implant? Is that something that would give better balance to your face? And then I'll give you the choice. Which one best fits you? Which fits your desires? This one or this one? By looking at figure A, you can see the nose is more projected, less rotated. Figure B, you're rotated further up, a little bit more of a concavity, a little bit more of acute nasolabial angle with a chin implant. What's your desires? What would you like? This allows me to understand what's best for you. Now, of course, I can't guarantee you 100% what's on this computer, but it does allow me the opportunity to understand what's important to you, and then I can do my best to reach your desires. So which type of technique of rhinoplasty or nasal reshaping is best for you? Well, there's multiple approaches to the nose, but the two main approaches that we use in order to improve the appearance and the function of your nose is either the open approach or the closed approach. In the open approach, we make a tiny incision into the columella. That's the thin skin between the nostrils, and we lift the skin off the tip of the nose. In a closed approach, all the incisions are made on the inside, and you can't see any of the incisions. Now, which approach we use varies based on many factors. One is what you're trying to achieve, and also the function of the nose. Do you need procedures in order to make your breathing better? If so, we may have to do an open approach. Generally speaking, the open approach results in more swelling and more downtime. It takes longer for you to see your result. However, if we do the closed approach, with incisions made on the inside, you tend to heal much faster. Because I enjoy the closed approach, I try to do that more often. And I will talk to you about the two different options, and I'll tell you which one may be best for you. If I'm doing a procedure in order to improve your breathing, it's more likely that I'll do an open approach. But if I'm doing a procedure to make you look better without affecting the breathing, then I may do a closed approach. Either way, bruising and swelling is very unlikely. We've actually done surveys with our patients, and what we found is less than 5% of our patients get bruises. Less than 5% of our patients get bruises, and they're often surprised to hear that. Why do we have so few bruising and so little of this? I believe it has to do with the fact that we don't really break the bones much anymore. In the past, doctors were very insistent on breaking the bones. Today, I use a much more gentler technique. In fact, I use a rotating burr, something that is very mild and gentle to shave down the bones, much like you would do if you were filing your nails. And this is done in a way in which it doesn't cause a lot of trauma to the nose, so there's much less bruising and much less swelling, and you can expect to get your final outcome much sooner. Following rhinoplasty, what we most commonly hear from our patients is about how much better they feel about themselves. Frequently they come back to me and they say, "Doctor, you're not going to believe it. I got a new job. Everyone tells me how good I look. I get looks from people I never thought I would get before." And it's really kind of fun for me to see this, that patients are so much happier. And sometimes they don't even say anything, at least not outwardly, but they walk in and they're more confident, they stand taller, they stand stronger, and I know that they're happy. If they mention what other people say to them, it's always the same thing. People look at me and they say, "Boy, you look good," or "Have you been on vacation?" or "You look rested." Nobody knows that you had anything done, only that you look better. That is key in rhinoplasty. If somebody tells you you had a nice nose job, then in my opinion, it wasn't done right. But if you feel better about yourself, then in my opinion, everything was done just right.
The procedure I had done was a rhinoplasty, as well as a correction of my deviated septum. For one, I couldn't breathe. When I was young, I fell off my bicycle and hit the cement face first, so I wanted to basically be able to breathe again. And also, just my nose was kind of crooked, I wanted it to be straight again. I heard about Dr. Dayan through the internet. I did a lot of research. I saw some other doctors that I wasn't happy with, and when I met with Dr. Dayan, I felt a click. I really liked him, and that's basically how it all started. I came into Dr. Dayan's offices, and they were beautiful. I got seated in the room, and I met with Dr. Dayan. He was great. He had an awesome persona, I can't even describe it, just an awesome doctor, and very knowledgeable. I asked him about his experiences and basically about the surgery, and felt very comfortable. Before my procedure, I was always self-conscious about my nose. It was crooked, I couldn't breathe, I was always getting sinus infections, so it was always something that I needed to do, was very afraid of doing. I didn't know what the risks were involved, but once I got it done, I felt great. The changes were definitely a benefit. At first, when I saw the results, they were instant. I could definitely tell that there was, first of all, my nose was straight. The airflow was definitely something I didn't feel it, but after a while, after quite some time, I would say about 6 months after, it was amazing. I was total oxygen overload, but it was great. It changed the way I breathed. It definitely boosted my confidence. And I would say that I've gotten a lot of positive feedback from my friends, my family, my coworkers. Concerning research, I think it's extremely important. That's something that I did immediately. I would say it took me about 2 weeks to really contact Dr. Dayan before I did it. I went to his website first. I read some blogs about him that I found online. I met with some other doctors. So to me personally, research is very important, and it's something that everyone should do before having a procedure. My advice would be to make sure that you find a doctor who does a lot of these procedures. A doctor who, in my case, for instance, it was a dual procedure. It was the correction of the deviated septum and a rhinoplasty. So Dr. Dayan specializes in both, and that really appealed to me. The fact that he does other surgeries is a plus as well. So making sure that the doctor is board certified, as well as conducting multiple surgeries a year and has pictures to show you, are all things that you should look for in a doctor. I did have computer imaging done, and I think that's a great plus for plastic surgeons, and Dr. Dayan was amazing. It's fantastic how a patient's able to walk into a doctor's office and see their image manipulated to what the results are going to be. I was able to look at my picture and see about 90% of what my completed results are after the procedure. It's not exactly dead on, but it is in a sense, and I love it. Most offices don't offer that. They'll tell you, they'll draw a line, or they'll show you images of another person, and it's just not the same. This is great because it really shows you, you in a sense, and what the results are going to be. And after the surgery, Dr. Dayan also showed me images of my problem areas, for instance, my deviated septum, and I didn't know how bad it was. So I also think that this is something very important to patients.
One thing I think I would say that describes this experience is I'm just thankful. I'm thankful that I did it. I'm thankful that I found Dr. Dayan. I'm thankful that I found such a great, caring staff, and I'm just really thankful that I did this. I mainly did this because I just never really felt good about my looks, and it's just something I kind of wanted to do all my life, and I got older and just decided to make that change. So before I did it, I was somewhat confident, but I always kind of wanted to be behind the scenes. So after I had these procedures done, I just felt a lot more confident. I wanted to be out there, in society and doing things and going to social functions, and just, my marriage is better because I feel like I want to do things and get out and just be more sociable, and I just feel a lot more confident and better about myself. So the first time I came to Dr. Dayan's office, I was a little nervous, obviously, just because I had never done anything like this, and he just made me feel really at ease. He's very kind, his staff is very kind, his office is very comfortable, and just made me feel a lot less nervous about what I was going to have done. Answered all my questions and everything. Everyone was very kind and attentive to my needs, so that experience was quite easy, and I was comfortable about having the procedures done after meeting him and his staff. So I did do some research before I came in about what I wanted to have done. I kind of did a little bit of research on different procedures and kind of what it would entail and how long it would take to recover and what I would go through before and after, and just kind of wanted to get a little bit of knowledge. Although I didn't know everything and I had a lot of questions, I did do some research and found out a lot. There's a lot to research on the internet and that sort of thing. I think the most important thing to look for in a doctor when you want to have a procedure done is, obviously, first you want to make sure that they have the credentials, that they are board certified, and they've been in practice for a while, they've done the procedures, they're knowledgeable about everything that they're going to do. And I think, personally, I think that was the most important thing for me, is that he had done this before, and he's been in practice for several years, and he was really good at what he had done already. Actually, right after I had the procedures done, it was a little uncomfortable, but really only for about a week or two, and I was back to work. Still swollen, not a lot of bruising, but I noticed things within a year. I still noticed a year later some transformation. It was really fun to see before and after pictures, 3 months and then 6 months and a year later, and just to notice the change. It was exciting, and as far as right after, there was not a lot of pain. It wasn't incredibly uncomfortable, obviously, somewhat, but nothing that I wouldn't not do it again. I'd do it again in a heartbeat. So after my procedures, most of my friends and family obviously knew what I had done and what I was going to go through, but even the people that knew what I had done all said that I still looked like myself, but just better. People that didn't know I had anything done would usually just say, well, you look like you've lost weight, or you look different. I can't tell what it is, but you look different, you look good, you look awake. You know, before my procedures, people would always say, you look tired, or you look like you don't feel good, and I never ever hear that anymore. So since I had the procedures done, I never hear anyone say, are you okay, or do you feel good, or everyone tells me I just look so much better. So it definitely changed my self-confidence to have this done. I want to get out there, I want to do things, I want to go. Before I just wanted to stay home, I didn't want to go anywhere, I didn't even want to go to the grocery store. Now I look for things to do and ways to get out and to be out around people. For me, I think that it is important to have the natural results. I didn't want to look like I'd had a lot of work done. I didn't want to look fake, and that's the one thing I am so glad Dr. Dayan he's thinks that it's important that you look like yourself, and that was really important to me. I still look like me, just better, just improved. I think the one thing I would tell someone that wanted to have this done is to, look into it, but even if you're apprehensive, just go for it. It's the best thing that you'll ever do, and it's the best thing I ever did, so I think it's just go for it and you'll be fine. If anyone were, kind of on the fence about who they would go to and had other doctors, I would say Dr. Dayan would be my #1 pick, definitely, no questions.
Well, first things first, I want to say that his office has really exceeded anything I ever expected in terms of professionalism, just top of the line. I felt extremely safe. So the professionalism and just feeling safe just was above and beyond my expectations. I came in initially for rhinoplasty, and Dr. Dayan's office took some pictures, and then he did some drawings, and with the drawings of what he was going to do to my nose, he also drew what it would look like if I had done a chin implant. And I thought, oh my gosh, this is craziness. I came in here for a nose job. What is Dr. Dayan thinking? More? We left the office and we booked the appointment to have the nose job, rhinoplasty only. And then after some thought and talking to some friends, I decided to go ahead and have the chin implant done a day before my surgery. What I wanted everyone to know was how happy I am that I did decide to go do that. It was absolutely no big deal, and for the minimal amount of money that it cost to add that procedure in, made just, I think, a world of difference in the results. So that's all I want to say, and thank you so much to Dr. Dayan and his entire office.